Hello, my name is DJ Chuang. I'm a mental health advocate, executive director of Catalyst Wellness Alliance. And in this video, I want to talk with you about why we must improve mental health in Asian American churches and how. Now, the first question I sometimes hear, and you might be wondering, well, why Asian American churches? Well, there's two compelling reasons. One is the Asian American mental health crisis in America is increasing and ever more challenging post-COVID and with anti-Asian hate. And Asian Americans are the least likely of any racial ethnic group to seek mental health treatment, twice less likely than any other non-Asian, and 3 times less likely than our Caucasian counterpart. And I myself am Asian American of Chinese descent. And several years ago, I wrote a book about Asian American Christianity and next generation churches. So it is very much an intersection of my own ministry life and my personal life. I was diagnosed with bipolar disorder 23 years ago. And the first 10 years was a private, quiet, and heavy burden to carry. But as I realized that when I share my mental health journey, it opens more doors for ministry than when I open the Bible. And so in the time we have together, I want to share with you 4 reasons why churches can help Asian Americans overcome their barriers to mental health, and 5 ingredients to help your church develop its mental health ministry. And that's what we're here to talk about. So, 4 unique, distinct challenges and barriers for Asian Americans and mental health is 1, accessibility. The barrier of accessibility means that Asian Americans are a very diverse group, over 50 languages, over 50 ethnicities, and distinct cultural backgrounds. And in the American context, English is not enough. So the lack of accessibility means that Korean and Chinese and Vietnamese and Indian, of which there are more than dozens of languages, Japanese, Filipino, they're not able to access mental health in their own language and with their own cultural background. I myself have been regularly seeing my therapist for my own mental health care, and I'm very grateful for the times that I've had to work with someone who is from an Asian American background, because then I don't have to spend my time and money explaining my background because the professional therapist already understands. So you can see how valuable having someone that understands your family and cultural background can be, especially for Asian Americans. A second barrier for mental health treatment for Asian Americans is affordability. You and I already know the expensive health insurance, and many insurance packages do not cover behavioral or mental health sufficiently, especially for those with serious mental illness conditions, and all the more challenging among Asian Americans who actually do not fit the model minority. That a significant portion of our Asian American population live below the poverty line, and to seek treatment from some Asian American clinicians and therapists require paying out of pocket. I myself having to pay out of pocket, so it's expensive to get treatment and to stay healthy. So that's a barrier to seek mental health treatment for Asian Americans. A third one, availability. In my own mental health journey, it's been, on certain occasions, I've had to wait 2 to 4 months to find someone who's available to provide health services for me in my psychology and psychiatry. All the more challenging for Asian Americans who are seeking, when they get to that step, seeking mental health treatment and professionals, that they're not available. Not available because they have a waiting list, not available because they're not taking new clients, not available because there's not an Asian American professional in their geographical proximity. Now, with the advent of telehealth, that makes it a little more available, but still, we know in the Asian American and the American context, there's not enough providers to meet the demand. And the fourth, I would add acceptability. The lack of accessibility among Asians and Asian Americans to mental health. Some cultures and languages don't even have language for mental health. Very simply, they might think that someone is crazy, and you know how much that label stings, especially in a shame-based or shame-influenced cultures that many Asian and Asian Americans come from. And so the social and the relational stigma is not just an Asian American challenge, it is a global challenge. The Lancet Commission in October of 2022 came out with a study from 50 experts, and they realized that to really stop stigma about mental health, which is one of the biggest challenges for all people to receive mental health treatment, is stopping stigma. And to do that, we have to center people with lived experience. Now, in the mental health industry and the system, there's a lot of funding invested in research, developing medication, training professionals, but where in that world are people with lived experience centered and given the time and the resources to share their stories and to do that work of advocacy? That's a big missing piece. But that's also the greatest opportunity for the church to be a part of stopping stigma and erasing shame. And there's 5 things that churches can do to develop their mental health ministry, especially among Asian Americans, but this is also applicable to non-Asian churches as well. And to make it easy for you to remember, and especially those of you who are pastors that love alliterations, the 5 things all start with the letter S. First, speak about mental health in your sermons, because sermons stop stigma, according to Ed Stetzer. I should say Dr. Ed Stetzer. So the Bible has numerous examples of people struggling with depression, anxiety. Jesus talked about anxiety, not to worry. The Apostle Paul addresses it. There are times where we see people in the Bible struggle with suicidal ideation, even those who died by suicide. And so sermons help us to realize and recognize that God has something to say. God cares about our mental health, our spiritual health, and every aspect of our health and the human experience. So speak about it in your sermons. Secondly, stories. Stories erase shame. So sharing stories of people who've lived with mental health challenges and experienced hope and healing, and how faith has been a part of that hope and healing process, helps others and invites others to take care of their mental and emotional and relational health as well. So stories play a vital part to humanize the experience that many of us share when we go through those hard times, whether it's anxiety, depression, grief, loss, and other painful things that we experience as part of being people. Third, seminars. Reach out to Christian counselors or even people with lived experiences that have training to provide seminars to help people understand how mental and emotional health are a vital part of our overall well-being. One of the things that's particularly attractive and open to Asians and Asian Americans is education. So education is one of the biggest open doors that you can provide as a church to help Asian Americans understand why it is so important to address our mental health and not hide it behind the discomfort of shame, the discomfort of psychology and not understanding those things. Seminars can bring understanding. Fourth, support groups. Support groups provide care and support for people who are struggling with mental health and people with loved ones, families and friends that struggle with mental health. One of the most powerful things that the church can do that psychology and psychiatry cannot do is provide a safe place and a community of belonging. Dr. Thomas Insel, who was the director of the National Institute of Mental Health, wrote a book titled Healing upon his retirement. And after his many years of experience in the healthcare system, he recognized that psychology and psychiatry provides treatment for the symptoms of individuals struggling with mental health. However, that's not enough. For someone to experience long-term recovery, they needed three things, and they start with the letter P: people, place, and purpose. And you know what? As a follower of Christ, as a Christian, as an Asian American, I realized that those three P's are found in the church. A church is a place where people are welcomed and belong. People have a place of belonging and they can find purpose. And so that's part of the healing journey the church can provide through support groups, through seminars, through stories, and through sermons. And for Asian Americans in particular, and I'm an advocate in non-faith secular spaces as well, is the church can bring more Asian Americans together on a weekly basis than any other kind of program or services. And so the church, we have a huge opportunity not only to care for those who are already coming to our church, but to care and support those who are in our community and our neighborhoods with the hope and healing through Jesus and through practical means of service and help. And then number 5 is Sabbath. Sabbath is one of the 10 commandments. God commanded it, God demonstrated it and modeled it, even in the creation narrative. And as we are recognizing in our own mental health here in America, that's so driven by technology and productivity, that we need a healthy rhythm of work and rest. One of the best quotes I heard is, we work from rest, not rest from work. And we need to incorporate that all the more in our church life, that people have time off at the staff and the volunteer level, and we can live healthier lives, mentally, emotionally, spiritually, and in every aspect, as we incorporate these 5 S's into our churches, whether Asian American or non-Asian: sermons, stories, seminars, support groups, and Sabbath. So thank you for letting me share. I'm so glad to contribute to this Thrive and Cultivate Summit. Would love to connect with you, and there's links and connections in the sidebar as we journey through this adventure of life and bring more health and wellness to the church together.